If you've lost a tooth or even multiple teeth, the good news is that you have several options for replacement. We asked our resident expert, Dr. Priveer Sharma of the Oral, Facial, and Implant Surgery Center in Charlotte, to explain a few of the most common options.
Regardless of why you've lost a tooth or multiple teeth, there are options on how to replace it. In fact, there are 4 options that a patient has when they have a missing tooth. One is simply to do nothing. By doing nothing at all, a dentist will be concerned with teeth around that area beginning to shift and altering the way a person can eat, chew, and bite. The second option is having something made called a partial. A partial is something that can come in and out of a patient's mouth, and it can replace multiple teeth or just single teeth. But just like I said, it's unfortunately something that has to come in and out and will wear a little bit quicker, and something most patients are most self-conscious about. A third option is something called a bridge. A bridge, simply placed, is where they take that missing space and they put caps or crowns on the 2 teeth that are next to it. And by doing so, then they can re-cement that bridge that spans that gap. That bridge is a great option because it replaces those missing teeth. It allows them to have something they can chew with that's relatively permanent. The downside to a bridge is that if anything should happen to any one of those teeth now, be it a cavity, be it chips, or it stains, it always has to replace now in sets of 3. So that 1-tooth problem just became a 3-tooth problem for the rest of your life. The fourth and final option is a dental implant. A dental implant, simply placed, is really nothing more than a root replacement. It allows the dentist to replace the missing tooth and the root that's lost so that they can make just 1 crown, place that 1 crown onto your tooth, and so that you can have as close to a natural replacement as possible. Simply put, it's allowing that 1-tooth problem to remain a 1-tooth fix. And in the future, if anything should happen to any of the teeth around it, it allows it to be fixed just like they would on a natural tooth. Dental implants can become a wonderful option for you because they allow us to do conservative measures to allow you to replace the tooth or teeth that you're missing and give you the security that you're looking for. It, for me, is the closest thing to a natural tooth replacement that we have available today in dentistry. And that reason alone makes dental implants a great solution to help patients return to the quality of life that they're hoping to achieve, have the smile they wanted to have again, and then give them the confidence to go through life with the teeth that they now have.
Dr. Sharma explained 2 options. One, the permanent implant, which affects just the tooth that I broke. And the second option was the bridge, which affects not only the tooth that I broke, but the tooth on either side. If anything went wrong in the future with my teeth, I didn't want to have to replace 3 for just the 1 tooth that I damaged at that point in time.
My familiarity with implants was very minimal. I had heard about them, but never really investigated or had a need to even discuss it with anyone that knew about them. Yeah, Dr. Sharma explained everything in great detail and made it, put it on a level where, anyone who wasn't in a dentist could understand it. And so I felt very confident that the decision I was making was based on all the information I needed.
Well, when I went into Dr. Sharma's office and saw him, several things became apparent. Firstly, he's a good communicator. And secondly, he's funny, and I value that. But the third thing was, he looked at it and said, yes, we can do an implant on that. And he offered an implant, and I like doing new things, plus it would be a zero maintenance thing. And the consequence was that I said, yeah, let's go for it. And then he said, it'll be wasted if we don't fix the rest of your teeth. Well, that was news to me. I knew that I'd abused them, but apparently I had ground them down to the point where really the front teeth were not functioning.
Dr. Sharma was very clear in telling me just all the things that I would have to go through. He looked at my mouth at first and he said, I don't really think I can do an implant there, Shirley, because your gums are not right. So we had to do some surgery, bone grafting on my jaw, and then make room for an implant that would work.
I chose to get an implant instead of a bridge or something else because I personally feel that it is the best thing to do. A bridge, for example, you're destroying 2 good teeth on either side of the void. So that's why we chose the implant. I do believe it's a much more secure way of restoring the tooth that was lost.
Now, if you're in a situation where you're going to lose all of your teeth, or you're already missing all of your teeth and wearing a denture, and are unhappy with the fit of that denture or the security that you have when you wear that denture, there are options available to you also. They include dental implants being placed in an area in where you can have your dentures, use them as anchors to attach to and become more stable. In instances, you can get away with as simple as just 2 dental implants being placed in certain areas of your mouth so that your denture now has the ability to snap into place, but more importantly then, keep it secure and stable so it won't come loose or fall free, and allowing you the ability to regain the confidence of having natural teeth. This is an option that many patients who are missing all of their teeth really enjoy because it allows them to remove the denture from the roof of their mouth, improve the way they can taste and feel foods, but more importantly have the confidence of talking, laughing, and singing without the fear of their denture coming loose or coming free.
When Dr. Sharma was explaining the options to us, he told us that what we had to do was take and either use the gel to keep the plate in, or we could go with titanium implants, which would be more secure. So that's what my neighbor told me also. He said, don't go with the gel because you may have problems with it holding him in.
Next, more information on how you can learn more about your second chance for teeth. Then an overview of the implant process. Are you ready for a healthy smile that's as functional as it is beautiful? Visit secondchanceforteeth.com today to reserve your place at a free seminar that will tell you everything you need to know about your options for tooth replacement. The Second Chance for Teeth seminar is held on an ongoing basis at the Oral and Facial Education Center, so choose a seminar that fits your busy schedule. A professional from the Oral Facial and Implant Surgery Center in Charlotte will explain the entire process and benefits of dental implants and answer any questions you may have. Don't let your second chance for teeth pass you by. Visit secondchanceforteeth.com. Reserve your place or call 704-544-4340 for more information about this free seminar. Space is limited, so make sure you reserve your spot today.